So this was something that I wanted to bring to attention. It's really, really cool when you see PT pop up and not being spoken about, or the conversation not started by physical therapists. We talk about ourselves and what we do all the time, right? We talk about it with each other. We talk about it with patients. We talk about it with people who don't even know what we do. But there was a recent report about a week ago that came out from this organization called Peterson Health. I'll bring it on the screen for those of you watching the live stream, and we'll put the link in the show notes. This is an independent organization, so it's called Peterson Health Technology. And I don't really know a ton of the background on this organization, but if you scroll to the bottom of their website, they've got not only Peterson Health Technology, but like Peterson Philanthropy, stuff like that. So they're an organization that sort of does these third-party reports. They pick a topic, and then they say, all right, let's get to sort of the bottom of this. So the thing I wanted to highlight was this report that came out. Let me switch screens here. So this report came out. It was great to see APTA jumped on it, probably because the results were pretty good for PT, but it's around what you and Dave and myself have been talking about for the last couple of weeks. And that's around virtual MSK solutions. So I think the two hot topics on the last couple of months have been artificial intelligence. We've been talking about that. We'll continue to talk about that. Our grandkids will be talking about that. And this other virtual MSK solution. And, remember back to 2020 when virtual care was not possible. And then all of a sudden it was absolutely necessary. And, necessity is the mother of invention. So this independent report, I'll share the breakdown. They do some cost analysis too, which we can get into the weeds. But I thought this chart that they put up summed it up. So here's what they did. They called it Peterson Health Technology and Institute category level rankings for virtual MSK solutions. And I do want to preface this, right? So while this report is about physical therapy, our friends who do neurologic or vestibular care, this is focused on MSK care, right? Because I got some people who work with, patients post-stroke or post-traumatic brain injury. That's not what this report was looking at. This was looking at what they called traditional low back pain. They mentioned several times in the report, right? So they broke it down to three categories: app-based exercise therapy, and they give some examples. Kaya Health being one of them. I hadn't heard of the other one that they had. Dario, had you heard of Dario?
I have not.
Okay. Physical therapist guided solutions. So the first category is app-based, sort of PT, hands-off. The second being physical therapist guided solutions. Good to be back. And then the third would be RTM, remote therapeutic monitoring, augmented PT solutions. Now it broke those three categories: app-based, PT guided, PT augmented. And then it ranked it in clinical effectiveness. Does it do what it actually claims to do, right? Does it actually get the job done? And then it looks at the number. So it's matching, or it's pairing value plus cost, and that's a value proposition. And then it sort of gives it a breakdown and a summary. And it ranked it in a couple different ways: positive, negative, and moderate. So positive, negative, and neutral. And then higher clinical evidence certainty and lower clinical evidence certainty. So like, how positive, how neutral, how negative was it? And then how sure are they about that? So it was in my view, just from this cursory look, it was looking at it and saying, okay, how well are these things? And then how well can we actually rank them? And before you looked at this, what would you have thought would have been the best and the highest ranked level? Would it have been app-based, physical therapist guided, or RTM, or physical therapist augmented solutions?
I mean, I would have said physical therapist guided, just because you have that human accountability aspect. There's a relationship there.
Yeah, me too. I would have said, and of course, as physical therapists, we want to see that pop up, right? Because we're all nervous, myself included, that hey, maybe we're going to get replaced, and that's why I mentioned AI at like the top of the intro for this. But that's what it was. So let's go through it. So physical therapist guided solutions, and they used examples, and I'm sure we've talked about a couple of these platforms: Hinge, Omeda, Recovery One, Sword, Vori. I'd heard of Hinge, Sword, and Recovery One. I hadn't heard of Omeda or Vori. Have you?
No, same
No?
with you. Hinge and Sword were the two that jumped out at me.
Right. And the results for physical therapist guided solutions were of this: clinical effectiveness. It gave it a positive ranking, a positive or ranking, or grade. It also said lower clinical evidence certainty. So what it's saying is, like, the results we got were positive, but we need more evidence to actually back this up before we give this an A+. So that was good. They were able to, with higher clinical evidence, go into the economic impact. So in terms of results for physical therapist guided solutions, they said these platforms overall improve both pain and function comparable to in-person PT. And that makes people real nervous, right? Because they're like, wow, it's comparable to in-person PT, except it was still delivered by a PT.
Right.
We're just talking about a where and a how, right? Going down the line, well, now what's the money? Where's the money go? Is this going to continue? Will things get funded? Will insurance companies reimburse for this? The economic impact, they had a higher clinical evidence certainty, and their impact was positive. And it said it decreases net spending relative to in-person PT with savings from avoided care. Essentially, what they're saying, or how I read this, is overall spending is lower when compared to traditional how we're receiving care right now. And they're accrediting this to what they're avoiding down the line, which is also harder to prove. It's harder to see. It's harder to sell, right? This is like when Allstate does the ad campaign with Mayhem. Like, it's harder to sell. Like, you need to actually like make it tangible. So what they're saying is it is a decreased net spending, so a net savings relative to in-person PT with savings from avoided care. And then their overall rating for guided solutions is evidence supports broader adoption. Positive ranking in terms of physical therapist guided solutions. Now, I would say the next best, or the next highest ranking for them, was app-based, and that's like Kaya Health or Dario. I'd heard of Kaya Health. I got a friend who works there, but I hadn't heard of Dario. Their clinical effectiveness, they said it improves pain, but not function, not suitable. Not substitutable. Is that even a word? I mean, it's on the report. Don't replace it for in-person PT. Evidence certainty lower. So it was giving it a moderate ranking in terms of effective. Like, yeah, it proves some pain, but not necessarily function. Don't swap it out for your in-person PT. They do need more evidence, they said. Economic impact, pricing data wasn't available. And overall, their summary rating was evidence supports broader adoption depending on price. So they were saying, like, listen, if we're going to give this a juice versus squeeze rating, we need more information on economic impact. We can't do it. And then RTM, or remote therapeutic monitoring, augmented PT solutions. They were saying clinical effectiveness, same grade as PT guided in terms of needs more information or lower clinical evidence, but a positive ranking, saying it may perform better than in-person PT alone. Now, the economic impact was it increased net spending, and the savings from avoided care are less than when you add in that RTM billing. So looking into that. Overall, it gave it a neutral rating. Ongoing evidence generation may be needed, may justify broader adoption for patients with higher acuity MSK conditions. So it broke this thing down, but now we're seeing an independent monitoring agency, this isn't us talking about us, saying, okay, if we're talking about virtual, this is a big ambiguous term. Virtual means a lot of things. It can mean a lot of different things. What are they? They're starting to break those things down into those three categories. And they're starting to at least say, what are the results? We've been doing this for a while now, or these platforms have been around for a while now. We're seeing adoption. What does this thing look like? What does it shake down for our profession?
I love it. I think it's awesome. Anything that brings attention to what we do is amazing. My first thought, my brain always goes to, okay, how can we leverage this today? Not when the research is done, not 17 years from now. How can I make an impact, make this work today? And one of the things that I'm looking at is, and I've talked about this before. So I think, Hinge and Sword, they used to claim like no physical therapist, they were available if needed. But then they got some backlash, and now there are physical therapists that are involved in it.
Right.
My family members, brothers-in-law, sisters-in-law, they send me articles and stuff that their employer sends them, always offering Hinge and Sword. Every single one of them. They work for large companies. Some are engineers and different things. They always have like mail, and in the newsletter, it talks about, free access to musculoskeletal care through Sword or Hinge. Uh, but the apps, so the app only isn't as effective as the PT guided. So why don't we get involved with the app only solution, since we're not going to be in with Hinge or Sword, and
Right.
we just find an app that we like. We know users are on the apps already. Let's start marketing to those apps specifically. And I then become the provider of choice for whatever that app is. And I don't remember any of the names, but I think there's a real opportunity there. Somewhere in the world, there's a user, they buy the app, they don't use the app isn't as effective. Kaya was one
Yeah.
that I researched a while ago. Why wouldn't I generate SEO optimized content, create video content, showing how I can be your therapist if you're already using Kaya? Because Kaya alone is not as effective as using
Oh,
Kaya with me as your
okay.
therapist.
I was
Just
going
like
to
I
ask
said,
you.
Peloton. Peloton is out there, thousands of Peloton users. I can be the Peloton physical therapist. I don't have to be employed by Peloton. I don't have to be contracted by Peloton. I just create content talking about how I can help a Peloton user position their bike and use their bike more effectively, overcome knee pain when you're on your Peloton, that kind of stuff.
So you'd be like a remora fish
Yeah.
swimming around, like, it'd be a symbiotic relationship. Like, listen, we don't have a formal agreement, but you're doing this thing. Go do you. I'm going to be over here, and I could help you. I mean, it would, I could see like an organization, like the Peloton example is good, right? It's easy to see. Peloton is like, great, keep our riders riding longer because we
Yeah.
want that $40 a month. We want more people to buy $2,000 bikes and I don't know, $4,000 treadmills, which is a wacky. Do never buy a 4,000. Buy it used. Like, that's my recommendation. Yeah. So you're saying, listen, the guided solutions at Hinge and Sword, you're not going to get in, but where's the opportunity? The opportunity is on the top row. If you're watching a live stream, that's app based because it's not substitutable for in-person PT. Great. So apply that, make it supplementary. Add you plus a Kaya or a Dario.
And it's technology that I'm never going to build. I'm never going to
Yeah.
create, right? Like I'm not going to create Facebook, but I build a business on the Facebook platform. And you just look at the different levels. Like Facebook can't exist without the internet, but Facebook didn't build the internet. They
Right.
built a business on the internet. I can't build Facebook. I build a business on Facebook. These are the same kind of opportunities that we see. So I think this is where kind of stage 2 of private practice ownership is going. And this can be a one-person business. You don't need staff. You don't need admin. This could all be virtual, or it could be in person. I could be the local Cincinnati provider of in-person services. I meet with these individuals once a month. Yeah, there's just so many ways that we can make this work today in our businesses.
What if you added like a Movement X, like who already sort of have an infrastructure? Are you familiar with Movement X?
Yes, I am.
Yeah. Like if you took a Movement X and you were like, hey, add this, like, okay, instead of us being in competition, we're not. I'm not an app and you're not, you don't have physical therapists on staff. How do we come together? It doesn't need to be formal necessarily to start anyway. How do we yes and?